Dr. Suresh K. Pandey, MBBS, MS in Ophthalmology, PGI and MR, is Director of Suvi Eye Institute and Laser Center in Kota, Rajasthan. An acclaimed interior segment surgeon, he previously worked at leading global eye institutes, including the Storm Eye Institute in USA, the John A. Moran Eye Center in the USA, and Sydney Eye Hospital in Australia from 1998 to 2006. Returning to India in 2006, he established the Suvi Eye Institute, which has since gained international recognition for advanced ophthalmic care and charitable services. Over the past decade, he has treated more than 15 lakh patients and performed over 1 lakh routine and complex eye surgeries. Dr. Pandey has delivered 100 plus scientific presentations and authored over 100 peer-reviewed papers, 40 book chapters, and 8 textbooks, including the best-selling pediatric cataract surgery. He has received numerous prestigious awards such as the American Academy of Ophthalmology Achievement Award and Best of Show Video Awards at AEO, ASCRS, ESCRS, and EPA-CRS. He has performed live surgeries at major national and international conferences and twice received the gold medal from the Indian Intraocular Implant and Refractive Surgery Society. A dedicated teacher and reviewer for leading journals, he also leads several social and charitable initiatives. Now I request our Reverend Sister Principal to present a bouquet to Sir.
Thank you, ma'am. Thank you. Thank you. Thank you, sir.
Thank you, Sister. Let's welcome Sir with a loud round of applause.
Very good morning. Good morning, sir. Please say loudly, very good morning. Thank you very much. First of all, I would like to convey my sincere thanks to respected Sister Sheila for giving us opportunity to be here today with you all. So, I would like to request you to do a small exercise. Please close your eyes for 10 seconds. And now just imagine the darkness. Imagine that you cannot see the face of your parents. You cannot read any words from your book. You cannot enjoy the beauty of the nature. You cannot watch the beautiful sunrise, and you cannot see anything in the world. It's complete darkness. Now please open your eyes. Now you imagine the kind of darkness blind people or visually people are facing each and every day. So this is the power of eyes. This is the power of sight. The most important sense, the sense of the vision. Therefore, we always say that eyes are the window to the world. Eyes are the most beautiful gift given by the God. How many of you have taken pictures from the camera? Please raise your hands. Wow, almost everybody. So, if I asked you that God has given us the most incredible camera, the most precious camera, the answer will be eyes. So eyes are the most beautiful, most incredible cameras the God has given to us. So we are here to celebrate National Myopia Week. National Myopia Week is being celebrated across India from 14th November to November 20. If I ask anyone, any student to define myopia, what is myopia? Any student, myopia क्या होता है? What is myopia? Anyone? Any student? What is myopia? Let me explain you. You can see your books without any problem. You can read your books. You can see your mobile phone without any problem. But when you have difficulty in seeing clearly on the blackboard or seeing clearly from distance, that is known as myopia. Myopia is also known as nearsightedness. In this refractive error, the person can see clearly the near objects. He or she can read the books clearly, but have difficulty in identifying the objects at far, or difficulty in watching clearly or reading clearly on the blackboard. That is known as myopia. Now myopia is getting very common. If you talk about India, the incidence of myopia in 1999 was 5%. Only 5% children were suffering from myopia. If you talk about current time, 2025, 30% of children are suffering from myopia. If I ask you to raise a hand who, the children who are wearing glasses, please raise your hand. Children who are wearing glasses. Raise your hand, children who are wearing glasses. So I think it's 30 to 30%, approximately 30 to 40%. So same, same numbers are existing here also. So now the big question is, why myopia is very common? Can anyone answer this? कि इतना common क्यों हो गया? Why myopia is so common? And yes, please. What is your name? Come forward. Why myopia is so common? Mike, please.
Due to the more screen time.
Yes. What is your name, beta?
Radhika.
So, big round of applause for Radhika. I want to present you a small pen as a prize. So thank you so much. So it's very Radhika told very appropriately because of prolonged use of mobile phone. Because of prolonged use of mobile phone, myopia is very common. The most important reason why myopia is very common, we are using mobile phone, we are using our eyes very excessively for long time for near work. In other words, हमारा जीवन 1 मीटर के दायरे में सिकुड़ चुका है. 1 मीटर के दायरे में हमारा पूरा का पूरा जीवन, पूरी लाइफ स्पान सिकुड़ती जा रही है. Why? Once we wake up in the morning, we come to the school, we study, and then we go back home and we do our homework and we go to bed. This is the most important reason. There are other reasons also why myopia is very common, getting more and more common. If you talk about some countries like Singapore, Hong Kong, China, Taiwan, South Korea, North Korea, Japan, the incidence of myopia is 80 to 90%. This is alarming. This is alarming, and if we will not do any effort, if we will not take any measure, then the same situation will happen in India also. That's why we are here, to educate you, to talk about myopia. So the first reason is told very nicely, appropriately by Radhika, that prolonged use of mobile phone, prolonged excessive use of smartphone is one of the most important reason of myopia. The second reason is lack of sunlight. Most of the children and most of us are doing the work in the artificial light. I am very happy to see here, sister, that this is one of the very few schools in Kota where the sunlight is the children are doing exercise in the sunlight. So I want to congratulate the entire school, faculty, principal ma'am for giving the opportunity to all children to spend their morning in the sunlight. Sunlight is the biggest source of one hormone, that is dopamine. Dopamine is a hormone which prevents elongation of the eyeball. What happens? This is our eyeball and the length of the eyeball is 23 millimeter. When we work in the artificial light, when we work in the indoor, when we work with the smartphone, then there is a chances of myopia because of elongation of the eyeball. The length of the eyeball is 23 millimeter and 1 millimeter elongation of the eyeball can lead to -3 diopter of myopia. So you are sitting here, I can see the beautiful sunlight is coming here and I have not seen any artificial light here, just with the exception of this. Everything, all sunlight is, you are, starting your morning with sunlight. So this is the biggest source for prevention of myopia, sunlight. Number 3, why myopia is becoming more and more common. Number 3 is fast food. We are not eating healthy food. We are eating fast food. Fast food like Maggi, pizza, burger, chow mein. All these foods contain refined sugar and carbohydrates. So these fast food, once you eat any high fast food containing high sugar, it pumps insulin from our body, and insulin can lead to elongation of the eyeball. So these are the reasons why myopia is very common. So let us talk why it is important to talk about myopia. Myopia is simply not a refractive error. It's beyond that. Once there is a myopia means inability to see clearly for distance, then you need to wear glasses, like minus glasses. And myopic people are more prone for 3 most important diseases. One is glaucoma. ग्लोकोमा इज ए ब्लाइंडिंग डिजीज, जिसको हिंदी में काला पानी भी बोलते हैं. काला पानी यानी ग्लोकोमा. इस ब्लाइंडिंग डिजीज एंड मायोपिक्स आर मोर प्रोन फॉर ओपन एंगल ग्लोकोमा. द सेकंड इज कैटरेक्ट. Cataract is once our lens, this is our normal lens, I will show you. So this is our normal lens. And once this get opacified like this, then this is known as cataract. This is the cataractous lens. This is the normal lens. So you can see the opacity. This is the normal lens which is transparent, and this is the cataractous lens. So myopics are more prone for cataract. And third, myopics are more prone for retinal problems, like retinal detachment, retinal holes. So therefore this is very important to understand myopia. And those children who are putting minus glasses, there is a change in their personality also. Sometimes it's difficult for them to participate in the sports. It is difficult for them to participate in the extracurricular activities, outdoor activities. So therefore, we need to put all our efforts to prevent myopia. So let us talk about the 5 important things to prevent myopia. So this is our eyeball. The total power of the eyeball is 60 diopter, 60. And this is the cornea. The cornea is transparent structure of the eye, and the total power is 44 diopter. So cornea is avascular. There is no blood supply. It takes its nutrition from air. And once you do repeated rubbing of the eye, then the shape of the cornea becomes like conical shape, and that is known as, उस बीमारी को क्या बोलते हैं? Keratoconus. That is known as keratoconus. So keratoconus is a disease where you repeatedly rub your eyes, or you sleep with prone position, and then the shape of the cornea becomes distorted. It becomes like a cone, like a conical shape, and that can lead to distorted vision. So therefore it's very important that never rub your eyes. Never rub your eyes, because this can lead to keratoconus. And also always avoid using, or be very careful while using firecrackers, or take care of your eyes with injuries, because eye injury can lead to cataract. So this is very important. And we have the inner part of the eye. So this is the part of the eye. This is known as, this is the inner part of the eye. This is the iris, and because of the iris, the color of the eyes are brown or blue. And this is the optic nerve, and this is the retina, the innermost part of the eye. This is retina, and retina is a structure where you can see the blood vessels live. Retina is the only structure in the body where you can see the live blood vessels. Some diseases like diabetes, hypertension, you can identify by seeing retina. So let us focus on 5 important things for good health and good eyes. The first thing is, take proper sleep. Take proper sleep, at least 7 hours of good sleep. With the frequent use of smartphone, most of the children are spending more time in watching reels and watching videos. So we are seeing, we are sleeping at 11 o'clock, 12 o'clock, sometime even later than 12 o'clock. So let us take a place that we will sleep at 10 or 11 o'clock and take at least 7 hours of sleep. Okay? 7 hours of sleep. Second, always eat healthy diet. Eat rainbow. Somebody can anybody tell me what is the meaning of eating rainbow? Yeah. किसने बताया? Come. So this is small prize for you, beta. What is your name? Vanchika. Very good. So it say something. Carrot and?
Radish.
Okay. So good, very good. So big round of applause for Vanchika. So eating rainbow it means you have to eat the color food. Eyes love color foods. Color food means carrot, papaya, mango, guava, green leafy vegetables, spinach. So this is known as eating the rainbow, color food. Okay? And third is, so we talked about sleep, we talked about the food. Third is practice 20-20-20 rule. 20-20-20 rule. Can anybody tell me what is 20-20-20 rule? Okay, come. Big round of applause for Anya. Thank you. You take your prize, beta. This is prize for you. Thank you. So very rightly told by Anya that 20-20-20 rule is, you after working 20 minutes on the smartphone or computer, you have to take a break for 20 seconds and then look 20 feet up far. This is known as mini vacation for the eyes. Okay? So 20-20-20 rule is very important in this digital era. And next is, to prevent myopia, we had to at least once in a week every Sunday. Most of the kids are sleeping on Sunday like till 10 o'clock, 9 o'clock. So Sunday wake up at the same time and spend 1 hour doing outdoor activities with sunlight. So how many people are doing outdoor activities? Very good. Wonderful. Wonderful. So every Sunday do at least 1 hour outdoor activities with sunlight. Okay? So these are the 5 things to prevent myopia. Now we have to just a word about happiness hormone. So anybody heard about the DOSE, D-O-S-E, the happiness hormone? D-O-S-E. So once we are happy in our life, once we are spending time with our family members, once we are spending time with sunlight, once we spend time doing exercise with nature, our brain secretes 4 types of happiness hormone. And the name are D for dopamine, O for oxytocin, S for serotonin, and E for endorphin. So these are the DOSE, D-O-S-E. These are the happiness hormone, and these happiness hormones are very important in life. So let us start from today that every day we will take 7 hours of sleep. Number 1. Number 2, we will eat rainbow, means color food, carrots, papaya, spinach, green leafy vegetables. So all that we will eat rainbow. Number 2. Number 3, we will practice 20-20-20 rule. We will practice dopamine fasting. Dopamine fasting means once in a week you have to avoid using smartphone. That is known as digital detox. Okay? Number 4, we will do exercise every Sunday at least for 1 hour with sunlight. And last but not the least, we will go for annual eye examination. At least visit once in a week, once in a month, once in a year to nearby ophthalmologist. So these are the 5 things I wanted to convey on the occasion of National Myopia Week. So if you have any question, we will be happy to answer, and we will be happy to organize an eye camp for you also, if with the permission of principal ma'am, so that we can do eye checkup and we can educate all children about the eye disorders and refractive error. So if you have any question, I will be happy to answer.
So how can we remove myopia?
Yeah, that's very good question. That's wonderful question she asked. So how to correct the myopia? So the myopia can be corrected by three measures. I have talked about the prevention of myopia. How to minimize the progress of myopia. Now, once you have myopia, how to treat them? The first treatment is by glasses. This is the minus glasses I am also wearing. I am also myopic. So by glasses. So number 1, by using glasses, minus glasses, concave lenses. Number 2, by doing laser refractive surgery. So once we do the laser refractive surgery, we can modify the power of the cornea. This is the cornea, and this contains the 44 diopter power. So we modify the power of the cornea, and therefore we correct the myopia. The third thing, that we have special lenses which can help correct myopia, and which can correct myopia up to -20, -25, -30 diopter. So lenses can correct myopia. So phakic lenses. So there are 3 methods to correct myopia. First is glasses or contact lens. Second is by doing laser refractive surgery, and third by phakic intraocular lens implantation. So these are 3 methods of correcting myopia. Anyone? Anybody else? Any question? Please.
So I wanted to ask that why do we use glasses for myopia and how does the rays of the light enter the glass and then the eye? So can you explain the procedure?
Yeah. So once you suffer from the myopia, the rays focus in front of retina. Because of the elongation of the eyeball, the light rays focus on the in front of the retina. So by using concave glasses, the light rays focus on the retina. So that's how you try to do this refraction by putting various glasses, -1, -2, -3, -4. Then it helps to focus the light on the macula. That is the most important point of the vision. So that is how you correct the myopia, by glasses. And you can modify the power of the cornea to correct the myopia, or you can implant an artificial lens to correct the myopia. That is how you correct the myopia. Yes, please. Please.
So I have 2 questions.
Yes.
So the first is, there is a saying that if you walk in the morning on green grass, that might improve your vision. Is that true or not?
Yes, that's very good, interesting question you have asked. Like, it's a myth. They are basically, they say that once you walk on the green grass, there is no scientific, studies supporting that. But always, sometime you need to understand that any saying or any popular belief has some supporting aspect. So once you wake up in the morning, once you walk in the green grass, it will give you many benefits. Okay. So, but of course, regarding the eyes, there are no published studies, but it's always good to walk in the morning, enjoy the sunlight, and be with the nature. That's good question. And next question.
Sir, my mother used to say that if you wear this, your eyes might catch an infection. Is that true or not?
Say it again.
If you wear lens, your eyes might catch an infection, and why is that?
Yeah, that's very important question. That's very important question you asked. Why using contact lenses? I want to tell each and every one of you that always be very careful using contact lenses. Always be very careful using contact lenses. Why? Because once we use contact lens, most of time, many children here students sitting here, they are not very well trained how to use contact lens. So you have to get proper training how to put the contact lens. So once you use contact lens for participation in some celebration or some function, then sometimes you use the contact lens, you try to remove it, you may scratch your cornea, and sometimes people are using contact lens with old solution. कई बार solution बहुत पुराना हो जाता है जिसपे solution उसका आता है, that can lead to serious infection. And I have seen cases of very serious eye infections. Person, sitting using contact lens, slept with contact lens on, and morning the eye is gone. So this is a very serious thing. So I would like to request you all that if you want to use contact lens, first of all minimize or avoid using contact lens. And if you want to use contact lens, then please get proper precautions for using contact lenses. Thank you so much. Anybody else? Any other question? Yes.
So you told us what is cataract, but you can explain how to improve and how to remove the cataract from our eyes.
Yeah, cataract is the commonest cause of blindness in India and globally. So this is our lens, and once there is a lens is get opacified, then it becomes like cataract. And the cataract is a commonest cause of preventable blindness worldwide. So to avoid the cataract, we need to follow the same thing what I have explained you. Eat rainbow and do exercise and protect your eyes from the harmful UV rays. And once there is a cataract, then the surgery is very successful. We do the phacoemulsification and we remove the cataract and we implant the artificial lens. This is how we do the cataract surgery. So cataract surgery is very commonly done surgery and the success rate is more than 99%. And the second surgery in the field of ophthalmology is the surgery for removal of glasses. That is known as LASIK, laser refractive surgery. So the cataract surgery is the first surgery, number one, first and the first most commonly done surgery, and the second surgery is LASIK, laser refractive surgery for removal of glasses. So, any other question? Yes. Yeah, that's a good question. Some people are color blind because of, in our eyes, there are special kind of cells which are known as rods and cones. So the cones are responsible for color vision. Okay? Those special cells which are known as cones are responsible for giving us color vision. So once there is a some defect in these cells, then the person becomes colorblind. And this is genetic. So this is genetic. Any other question? Yes. Please. What is your name?
Joanna.
Okay, please ask.
Sir, some people wear glasses while using phone, and what are these glasses called and how it is helpful?
While reading?
No, sir, while using phone.
Phone.
Or
Okay.
any
Yeah.
device.
So Joya asked that some people use glasses while using phone. So this is known as presbyopia glasses. Presbyopia is very common refractive error. Once you approach after 40 years of age, our ciliary muscles of the eyeball, the special muscles which help us focus near and distance. There is a weakness in the ciliary muscles, and that's known as presbyopia. Therefore, after age of 40 years, you must have seen your parents that they start reading like this. दूर से दिखता है उनको पास से दिखता नहीं है. That is known as presbyopia. This is not a disease. This is part of aging process. 40 साल के आसपास 40 years, around 40 years, we face difficulty in reading. That's known as presbyopia. So I think this is all for today. And once again, I want to thank respected Sister Sheila for giving us an opportunity. Thank you so much. Thank you.